Hi, I'm Dr. Chris Tanazzi. I'm going to tell you a little bit about no-scalpel vasectomy today. This is a procedure that I've been doing for the last 25 years. First of all, a little bit about the anatomy. What we're trying to do is stop the flow of sperm from each of the testicles up through the vas deferens and then out the urinary system. The no-scalpel vasectomy uses a minimally invasive technique where first we numb up the skin, and then we use a specialized clamp to bring the vas right to the surface of the skin, and then we use another specialized tool to puncture the skin, push open the skin. Instead of cutting it, we're pushing it open, so we're pushing blood vessels out of the way to avoid bleeding. And then we're able to grab the vas, bring it up, cut it. Generally, most surgeons these days will cut it, burn the inside of one of the ends, and then use a suture or a clip. I use a suture to hold that end of the vas down lower, allowing this end to stay up a little bit higher, making it less likely that those two ends are going to get together. And then this end, the upper end, is left open. That's called an open-ended vasectomy. That can help avoid a complication known as post-vasectomy pain syndrome if we leave that open, preventing pressure buildup in that end of the vas. I also use no needle anesthesia, where instead of injecting a numbing medication to numb up the skin and the vas deferens, I use a high-powered jet that pushes local anesthetic into the skin in the vas to numb up the area before starting the procedure. So you'll feel a puff of pressure against the skin. That's done several times to numb up the area. We can avoid using a needle for the procedure using this high pressure anesthetic system. Many men ask whether vasectomy will affect their enjoyment of sex. The vasectomy does not negatively impact your enjoyment of sex. It doesn't affect your level of testosterone, which is the hormone that controls your interest in sex, your libido. It doesn't affect how you have erections. It doesn't affect how you ejaculate. The semen will look exactly the same. It just no longer contains the sperm, but that's a very small proportion of what's in there. We're hoping that after the vasectomy, you'll enjoy sex more because you're not worried about getting pregnant and your wife's not needing to use a hormonal form of birth control. Let me explain some of the complications of the surgery. One complication is that you could continue to have sperm. We make sure you don't have sperm by doing a semen analysis 2 months after the surgery to see if there's any sperm left. And I strongly recommend continuing to use birth control until we've done that semen analysis. There's a smaller chance that eventually those two tubes could form a canalization, opening between the two of them, and that you could start to produce sperm and that they could get from one end to the other. Studies show that the risk of that is somewhere between 1 in 500 and 1 in 2,000 men will have a pregnancy later in life. That pregnancy risk is smaller than any other form of birth control, including the woman's tubal ligation. So that risk is very, very small. There's a small risk of chronic post-vasectomy pain syndrome that we talked about earlier. We think that's related to pressure buildup in the vas just above the testicle, below the cut end after the surgery. We've got some new medicines and procedures that are used to treat that. We think the risk of that is about 1 in 200 men will have this chronic post-vasectomy pain syndrome. Other risks, there's a small risk of having swelling despite using this using the no-scalpel technique, which really minimizes the risk of swelling. There's still a small risk of swelling. We think about 1 in 50 men are going to have abnormal swelling. There's a small risk of bleeding and a small risk of infection. Many men ask if the surgery is reversible. It is reversible, but the surgery is expensive. It's only done in big urban areas. Insurance doesn't pay for it. So it's much better to be as sure as you can be that you're ready for a permanent solution. The preparation for the surgery, there are a few things to do to prepare for the surgery. One is I recommend that you get 2 pair of compression briefs. Those are underwear that many men are using for workouts these days. They're a tight Lycra. You may be able to buy them at Walmart or other big department stores. If you can't find them there, you may have to order them online. They help hold a gauze and some Neosporin in place that we place right after surgery. Then I recommend that you use those for the full first week to apply a little bit of extra pressure and lessen the risk of swelling. The other thing is, in preparation for the surgery, you'll want to pick up medication. I generally prescribe 2 medications to take before the surgery. One is to help you relax. You take that about a half hour before the surgery. The second one is a medication for pain. You take one of those a half hour before the surgery, and you're left with a few to use after the surgery if they're needed. Most men don't need them. If you do use those medications, you'll need somebody to drive you to and from the surgery. You want to pick up the medications a few days in advance. Don't wait till right before the surgery, just so it doesn't complicate your arrival for the surgery. You'll also need to shave before the procedure. You can shave all of the genital area if you prefer that. You may already be shaving. The other option is to shave a smaller area, which would be just at the base of the penis and the front of the scrotum. You want to be sure it's nice and clean shaven. It's best to do that a few days in advance. When you come in for surgery, my assistant will bring you into the operating room. We warm up the room a little bit to relax the skin of the scrotum. That thins out the skin. Then we can find the tubes more easily. She'll get you settled in the room. She'll step out. I'll come in. I'll have you get undressed, put a towel around you. We'll check that you're well shaven, and I can clean that up if it's needed. We'll have you lay down. The first thing I do is administer the local anesthetic. And then I get you washed off and put the sterile drapes over you. Then before we get started, I check to be sure that you're numbed up. You may feel a small amount of pressure, but you won't feel any sharp pain. I can administer more anesthetic during the surgery if that's needed. After we have all of that set, the surgery generally takes 15 or 20 minutes. So you'll be ready to be picked up by your driver shortly after that. The recovery period, you should be on the bed or on the couch the day of the surgery, the evening of the surgery, as well as the full next day. I recommend you just take it very easy on the couch or bed. It's fine to get up to go to the bathroom or get something from the kitchen, but then you're back to bed or couch. On the second day after surgery, you can be up around the house doing light activities, desk work, kitchen work, child care, but you shouldn't be doing any workouts at home. You shouldn't be doing any big home projects, and I recommend that you not leave home that day. Then by the third day, you should be ready to get back to almost any job or any form of activity. You can start some athletics that day if you work out. Try it out in a small quantity. The following day, if it goes well, then increase. By a week after the surgery, you should be back to normal activity. We recommend waiting for sex or ejaculation until a week after the surgery. During the recovery, you should also be putting ice on top of the compression briefs over the scrotum in the area of the surgery to decrease the inflammation and help with pain. You can be taking pain medication after the surgery. You'll have a few of the prescribed pain medication that I give you. The other thing you can use is ibuprofen. You can take 600 or 800 milligrams at a time. That's 3 or 4 over-the-counter Advil. It's best to take those with food. They can, they'll generally take care of post-op pain very well. At 2 months after the surgery, we have you bring in a semen sample. At the time of surgery, we'll give you a small sample container, an appointment to bring that sample back in. When you come back in, for an appointment with me. I'll take your sample, look at it under the microscope, see if there are any sperm in it, and let you know right at that appointment whether it's okay to stop other forms of birth control. So that's no-scalpel vasectomy in a nutshell. Look forward to working with you.